Thank you so much. Does everything look good on your end? Wonderful. Well, happy National Public Health Week, everybody. Let's dive into it. So we started the pandemic off with a decade of decline. Over the past decade, the public health workforce has shrunk by approximately 56,000 positions, primarily due to funding issues. But let's put those funding issues in context, because we spent $3.6 trillion on healthcare in 2018, and less than 3% of that was spent on public health. A little odd considering we have been proven to have a 14-to-1 return on investment. Our health departments across the country are battling 21st century problems with 20th century resources. Many departments rely heavily on disease-specific grant funding, creating unstable and temporary positions. So what do we know about our workforce? Well, in 2017, 22% said they plan to retire in 5 years, and another 25% said they plan to leave in the next year for reasons other than retirement. And I can bet you that the pandemic has accelerated both of these timelines. Why are people leaving? Well, some of the top 5 reasons are inadequate pay, lack of advancement, workplace environment, job satisfaction, and lack of support. We're satisfied but still leaving, even though satisfaction was on there. It's a little contrary because it actually represents some high job satisfaction with a number of, or a high proportion of the workforce. But people are less satisfied with their organizations and even less so with pay. We're engaged. I think everyone in public health cares deeply about what they do, and that's why they're in public health. But we do not feel creativity or innovation are encouraged. That's worrisome considering we really need to be innovative. And things feel top down. Workers are suggesting that communication between senior leadership and staff is poor, and I think that extends to federal, state, and government leadership and organizational communication to our decentralized LPHAs. But Michael Jordan said it best: obstacles don't have to stop you. If you run into a wall, don't turn around and give up. Figure out how to climb it, go through it, or work around it. And that's something public health does very well. We figure out a way to overcome adversity. So what are some new opportunities? Well, we rapidly trained a new workforce this year. In Colorado alone, at the Center for Public Health Practice, with our partners, the Denver Prevention Training Center and the Patient Navigator Training Collaborative, we trained over 1,200 contact tracers, case investigators, and resource coordinators for the state response. And this is an ongoing project. So the question now is, how do we retain these people? Well, we're a part of a group that's actually looking into this. The Colorado Public Health Workforce Collaborative is a part, and led by the Trailhead Institute, is a part of the Public Health Pre-Apprenticeship Program. This is in partnership with the Community College of Denver and Arapahoe Community College, not pictured here is Metro, and even CU Denver and the school are all getting involved. This is to really chart a course for how people can get into public health, really trying to think of it as an electrician and how they apprentice to be an electrician in their workforce. We want to do the same thing with public health. And this is actually in partnership with the Career Pathways Public Health Program, or Career Pathways Program at the state. We also have a golden opportunity to retool our own workforce, because we have to prepare for a future where we are underfunded and underrepresented in politics and funding. So, you know, only 14% of the workforce has formal public health training, despite a 300% increase in public health graduates since 1992. I don't see that as a problem. I see it as a question of, what can we do with this 86% of the workforce? What skills are they bringing in? How can we best leverage these complementary healthcare skills and non-traditional public health skills? Because some of the top areas of training needs are budgeting and financial management, systems and strategic thinking, change management, and developing a vision for a healthy community. I'd add DEI, health equity, and communications to that. But I think now is the time to think about what we need to be trained up on most. We also need to fight for funding flexibility. Our local public health departments need more unrestricted funds. The administrative workload just to deal with the maze of funding in public health is unacceptable. Colorado's grown by 17% population-wise, but flexible funding has decreased by 19% over the same time period. Addressing long-term challenges like health equity and chronic disease while also responding to emergencies requires adequate infrastructure, not supported through short-term funding sources. When you got to let someone go in June and you have an emergency in July, well, what's going to be the problem? And this is some graphs provided by CalFO, who are going to be advocating for a bill that hopefully will be increasing this funding in the legislature this spring. Lastly, we expect to have clean air to breathe and safe water to drink, 2 vital public health responsibilities, and we only notice those when they're missing. We are moved when a disease is cured, but not when that disease is prevented, because it's a plot line where nothing happens. We know when public health is successful from statistics, not from personal stories. And whether in newspapers or on social media, statistics do not make an emotionally compelling argument. Statistics are important, but this leads me to my final point. We must get better at communications. We must do better at telling our story. We must do it for ourselves. We must illuminate and uphold each other in the amazing work that I know all of you are doing and everyone in public health. We got to do it for funding. We have to help the politicians in our world understand who we are, what we do, and why we do it. And then if this year has proven anything, it is imperative we do better with communicating with the public, because I mean, quite a big portion of the public doesn't understand where we fit into the governmental system and how we affect their own communities. So last, I just want to end on something positive. Don't confuse pessimism with profundity. Problems are inevitable, but problems are solvable. We may never have a perfect world and would likely be dangerous to seek one, but there is no limit to the betterments we can attain if we continue to apply knowledge to enhance human flourishing. I know we will continue to apply human knowledge and enhance all of human flourishing, and I hope you take a moment to celebrate yourself and your colleagues. Happy National Public Health Week.